With lack of drinking water and cracking in the disc combined with rotational movements, add to that being overweight, this is another risk factor. One thing that people who are overweight have in common is they're usually dehydrated. So drink more water. All of us should be drinking more water probably anyways. Throw away the idea of 8 glasses. We always lose track when we're at glass number 4, and of course glasses come in different shapes and sizes. It's better to actually take your body weight in pounds, divide that by 2, and in ounces, that's what we should be drinking. You want to try to get a container that is measured off in the beginning of the day, slightly warmer. I know it sounds gross in the beginning, slightly warmer than room temperature. The reason is it can go through you better. You're going to be going to the bathroom a lot right away, but you'll eventually have more energy and you'll burn it off more, and you won't have to go to the restroom as much as when you start out with this. If your water is too cold, it's just going to stay in your belly. It's not going to pass through your system until it cooks up to body temperature anyways. So it's impossible to get as much water as you should if you're always drinking cold water. It doesn't have enough time in the day to actually pass through. So again, body weight in pounds, divide that by 2, try to get that in ounces. That's going to decrease your risk factors for throwing your back out. So let's tie it all together. Check your rotational movements. How can you deal with that? Well, before you bend down to pick up that object or to do the gardening, try to remember this one thing. Try to remember to tuck your chin straight back like this, not down, not up. And when you do that, it sends a reflex all the way down your entire spine, where it's basically impossible to have bad mid-back or low back posture. One little trick there is, in addition to keeping your chin tucked in, just remembering to do that, is find your belly button. Right back there is the middle, behind in your back is the middle of your lower back, which is L3. And if you pinch the skin, I'm just going to use my sleeve like this, and then you bend down to tie your shoes, for example, try to maintain that same skin pinch. If it goes away from you like this, then what that means is that you're actually loading the front of your spine, and you don't want to do that. Say if you're facing this way, you don't want to load the front of your spine like that, because then you're compressing the discs and you're setting yourself up for premature arthritis and having your lower back or your mid back go out on you more often. Be careful for your rotational movements. If you're overweight, change your approach. Make sure you're staying hydrated. Keep your spine checked. What I can tell you is this: when you're in a regular maintenance program of care with us, you are way less likely to throw your back out. And if you do have pain, you're much more resilient because your body is dealing with gravity better. Keep this in mind. Upon a person having their back go out on them, what happens is they have the misalignment, number one. They have altered center of gravity, altered range of motion. The segments in the spine don't move like they should anymore. And this is what predisposes a person to having those individual segments be broken down, along with the short leg, the lower hip, and the twisting of the upper body framework. So remember, nerve interference is bad, the removal of it is good, and freedom of nerve interference is the best way to live.
Like, comment, subscribe, and share. Prior Lake Spinal Care, 952-226-7222, or email us at info@priorlakespinalcare.com.